talk about endometrial receptivity array, also called as an ERA test. We all know that for a successful implantation, it's not just a healthy euploid embryo but also a good endometrium which has receptivity matters for a successful implantation and pregnancy. So through our routine scans during the hormone replacement therapy for embryo transfer, through transvaginal scans, all fertility specialists do assess the endometrial thickness, its vascularity, pattern, whether the Dopplers are good. So is that enough for a successful implantation? No. The endometrium should express 238 genes on the day of implantation for a healthy embryo to implant, which can give rise to a successful pregnancy. So this test called ERA test or endometrial receptivity array is the test which determines whether the patient is expressing those 238 genes required for a successful implantation. Does that mean that all patients who are undergoing embryo transfer require this ERA test? The answer is no. About 90 to 95 patients who are undergoing IVF embryo transfers have a normal implantation window which is at about 120 to 125 hours post ovulation or post progesterone exposure. However, about 5 to 10% of patients do deviate from this window of implantation. So these are the patients who require endometrial receptivity array to get their own personalized time of embryo transfer. So generally this test is advised for a couple only after about 2 to 3 embryo transfer failures with good quality embryos. However, if you are doing an embryo transfer after multiple IVF cycles like a pooling cycle to obtain embryos, and if the embryos are very precious or probably have undergone a invasive testing in the form of PGTA, then you can ask your fertility specialist for this test whether it would be beneficial for you. So how is this test performed? So this test is done very similar to that of an embryo transfer. So the patient is called on second or third day of her menstrual cycle and the regular estrogen hormone replacement therapy is started. Once a desirable endometrial thickness and pattern vascularity is achieved, we start off the patients with progesterone administration. After about 120 to 125 hours of progesterone administration, instead of doing an embryo transfer, an endometrial biopsy is obtained through a simple pipple biopsy which is often painless, and this biopsy is sent for testing to assess for the expression of 238 genes which are required for implantation. So how do we interpret the ERA results? So the report can read as a receptive endometrium. It means that the time at which the embryo biopsy was performed was perfect for the implantation. So these patients will undergo embryo transfer at that particular time. If your report reads as pre-receptive endometrium, it means the embryo transfer should be delayed by say somewhere between 10 to 24 hours, the time of personalized transfer which will be given in the report itself. And if your report reads as a post-receptive endometrium, it means you have already lost the implantation window at the time which the biopsy was performed, and hence the embryo transfer should be done prior to the time at which the biopsy was performed. So ERA test usually gives a personalized embryo transfer timings where the patient will be capable of expressing these 238 genes which are responsible for window of implantation. As told, this test is not routinely done for all fertility patients who are undergoing IVF treatment. Hence, it's important that you discuss with your fertility specialist whether you require this ERA test based on the number of embryos available and also your previous treatment failures.